everyone. My name is Barrow Duffins, Director of Financial Aid. I'd like to welcome everyone to the Faculty Staff Info Session. At this point, I'd like to turn this over to Valerie Smith, President of Swarthmore College.
Thank you, Vero, and good afternoon, everyone. I'm delighted that so many of you are able to join us for today's information session. So today's session will focus primarily on the spring semester and will include updates to our COVID protocols. As members of the senior team and I reviewed the questions you submitted, we observed that certain topics came up frequently. We'll spend the majority of our time responding to the questions that came up repeatedly. And if time permits, we will address additional questions that come up in the chat. So you should feel free to add questions during this session. I'm going to begin with some brief remarks and then we'll open it up for a more general conversation. So during fall semester, we all worked together to see if we could bring students back to campus, maintain low positivity rates for COVID-19, and provide rewarding academic and co-curricular experiences. During the semester, we had almost 600 students on campus with more than 800 studying remotely. I'm pleased to say that our positivity rates for students, faculty, and staff for the fall semester were quite low, certainly lower than those in the surrounding region. 14 students and 47 employees tested positive for COVID between September and December. Now, some members of our community have asked whether we could relax our protocols since our rates were so low. And unfortunately, we can't. The epidemiologists and public health specialists with whom we have consulted have advised us that the appropriate response to the success of the fall is for us to keep doing what we're doing. As the number of new cases increases in Pennsylvania and around the country, we need to continue to be vigilant and to monitor test results and maintain restrictions. So I'm grateful to all of the members of our community, students, faculty, and staff, who have been willing to think about the common good and about their own health and safety, as well as the health and safety of others. Now, as far as the spring semester of 2021 is concerned, we are planning for a spring semester that looks very much like our fall semester. But as you know, priority for campus housing will be given to juniors and seniors in the spring, as well as those students for whom remote learning is not possible. Even though things are going relatively well, in fact, precisely because things have gone relatively well, our safety protocols for the spring will be similar to those of the fall. Now, I know that many of you have questions about the college's ability to obtain a vaccine and distribute it to the campus community. Swarthmore College has been designated as a Delaware County closed point of distribution, or closed pod. That means that we have been designated as a site for dispensing vaccines to our own populations while we continue operations during the public health emergency. As I mentioned in my invitation to this session, while some of our frontline employees who meet the Pennsylvania Department of Health's Phase 1A criteria have received the vaccine, such as our colleagues in student health and wellness and public safety, we do not yet know when we will have the supply to distribute broadly. We are in regular communication with local public health officials about when and how much of a vaccine supply we might receive, and we hope to be able to administer it to the campus community sometime this spring. So we'll share with you additional details about the vaccine as they become available. But in the meantime, based on recommendations from public health officials, we encourage anyone who has access to the vaccine through other avenues to pursue those options. And if you do receive a vaccine, we encourage you to keep the accompanying documentation. Now, before we move to your questions, I want to say something about the recent staff check-in survey. First, thanks to Robin Shores and Jason Martin for their careful attention and work on this project. And thank you to the more than 400 staff members who completed the survey. I'm grateful for your feedback and participation. So we'll be digging into the survey findings more deeply in the weeks to come, but I wanted to share with you some initial impressions. I was overwhelmed by the number of comments in the survey that expressed gratitude to the college and to your coworkers. Your responses reaffirmed what I experience every day, that your dedication to the college, to its mission, to each other, your dedication is truly profound. I appreciate the hard work that all of you have done and continue to do. But I also want to acknowledge something that many of you shared in the survey responses, which is that this is a very stressful situation for everyone, both professionally and personally. So I'm in conversation with the leadership team, and we will continue to consider ways of mitigating the stress and anxiety that many of us are feeling. And so we hope to partner and look forward to partnering with members of the community at large on solutions to this ongoing set of challenges. So please stay tuned for that. Okay, so let me run through the program with you for today's session. Joining me to help address your questions are Colleen Batista, the Environmental Health and Safety Officer, Greg Brown, Vice President for Finance and Administration, Anthony Coscignano, Assistant Vice President for Auxiliary Services, Catherine Geddes, Interim Vice President for Human Resources, Andy Hirsch, Vice President for Communications, Charmaine Lamar, General Counsel, Jim Terhune, the Vice President for Student Affairs, and Sarah Willie LeBreton, Provost and Dean of the Faculty. And I'm also pleased to welcome to the conversation Dr. Peter Axelrod, Professor of Medicine, Professor of Microbiology and Immunology, and Chair of the Infection Control Committees of Temple University Hospital and Fox Chase Cancer Center. Dr. Axelrod has been working with us on our planning efforts, and his counsel has been invaluable. Vero Duffins, Director of Financial Aid, will moderate this session. And as a reminder, again, in addition to the questions you've already submitted, please feel free to use the chat function to submit your questions in real time. And we will get to as many questions as we can in the time we have together, prioritizing those that come up most often. Please note that this program is being recorded, and we will share a link to the recording as soon as we're able to. Okay, so thank you. And Vero, what is our first question?
Thank you, Val. I thought we'd start off with Jim Terhune. Jim, there seem to be several questions related to what Val talked about at the very beginning, which of course is the return to campus occurring soon, and what that looks like in terms of move-in, return to campus, what clubs and activities may become available over the spring, and also some questions related to students who may be living off campus and what their access to campus may be.
Sure. Well, there's a lot there. I'll try to keep track of all of those questions, but you can remind me if I miss anything. In terms of return to campus, actually the very first group of a small group of students who were not already here, because as most people know, there's a group of largely international, but a handful of other domestic students who have been with us straight through because of their personal circumstances and ability to travel and so forth. So we've had a small group of students with us all the way along. RAs returned today. And so we've got that group coming back in. And then the majority of students who will be on campus in the spring will move back in beginning on Saturday through Tuesday. So we have 4 days of move-in. Students have scheduled times when they will move in. So it's all very closely coordinated so that we don't have a crush of students at any one time. We're able to spread the arrival out. When students are arriving on campus, the first thing they will do is they'll be going down to the athletic center for move-in and check-in. The first thing they'll do is to have a COVID test. So the student health center staff will be there to administer COVID tests there. For this first round of testing, we're using rapid antigen testing. So we'll get immediate results within 15 minutes for everybody. So if we do have anybody who tests positive right out of the gate, we'll be able to put them into isolation housing immediately, so they won't be going into the general residence population. They'll be isolated and so forth. Students, after they move in, classes begin on Wednesday, so February 10th. And for the first 2 weeks, everything will be remote. So even those classes that will have in-person components, those in-person components won't be starting until Monday, February 22nd. During that first 2-week period, students will be tested 2 more times. So they're tested on the day they arrive, and then they're tested 7 days after that and 7 days after that. So students will get tested 3 times in the first 14 days that they're on campus. And during that same 2-week period, we'll be having what we're loosely terming a soft quarantine period. In other words, we're asking students to largely stay in their rooms and within small groupings of students with whom they live. Obviously, they will be masking at all times and distancing at all times. During that same period, all meals will be takeout. So they'll pick up their meals and take them to another location to eat, so that we won't start in-person dining in Sharples until February 22nd again. So that's the plan for move-in. We expect that student organizations and activities will be taking place over the course of the term. Most student organization activities in the fall were primarily remote, so that students, both students who were on campus and those who were off, could be part of meetings and student organizations and clubs and so forth. We will be doing social activities on campus. There'll be no in-person planned social activities until 2 weeks in. So it'll be that first weekend. I think it's the weekend of the 19th, 20th, 21st would be the first time that students could gather. And even then, those gatherings are going to be in small groupings and so forth. And then I think the last question you posed, Vero, that was coming up was questions about students who are not in residence but living locally. We had this as a situation in the fall as well. And as Val said, we are staying the course with what worked for us in the fall. And what that meant was and means is that no students who are not residential, meaning living on campus, will be permitted to be on campus and you participate in in-person activities or use campus facilities. That's a hard decision to make. We know it's difficult for those students who are living close by, but we would point out that every student has had the opportunity to live on campus, and those who are not chose not to be. So I'll stop there because that's an awful lot of me to start this off. And I know there's a lot of other questions.
Thank you, Jim. I'll give you a long break. How's that? Appreciate the responses. There are a few questions related to the testing protocols, and I think some confusion perhaps in terms of what the protocols will be from this point going forward as they may relate to the fall and January term. I'm not sure who may want to take this question, but just to offer some clarification or just a reminder where this information may be.
I can help clarify that, Vero. So for the spring term, we will be following a similar process that we did during the winter break and J term. So during those periods, we decentralized a lot of our testing. Larger departments have taken over and done their decentralized testing and closer to their home departments. And other faculty and staff have been getting testing kits from the post office. The Scheuer room was open and not staffed, so that staff had a location to take the test if they needed to. That process will continue through the spring term. At that time, we also did make a change to the policy that if you were coming on campus and did not intend to have interaction with others, that you were not required to take a test. We are going to stick with that policy change, and it will be applicable for spring term as well. If you are coming on campus weekly, you are still required to partake in the weekly testing. If you only need to come onto campus for a specific week and you intend to interact with people, you will still be required to take a test 7 days prior to, at least 7 days prior to coming on campus. So I hope that helps with some of the confusion. I did see in the chat that there seems to be a discrepancy in the web information, so we will take a look at that and make sure we clarify.
Thank you, Colleen. Just to follow up with that, how would you define significant interaction when you were talking about having to do it if you were interacting with someone?
Yeah, so if you're going to interact with somebody for more than 15 minutes in a 24-hour time frame, then that is considered, you would need to be having testing done. So if you're going to come into your office, there's nobody else on your floor, you're not intending to interact with anybody, you do not need to perform testing. If you're coming in to pick up the mail and leave, we're trying to get some of the pressure off those people completing the test. If you do intend to interact with somebody for more than 15 minutes, you're required to perform testing to come onto campus.
Another question is with regard to the remarks that Val made earlier with the college's limited supply of vaccinations, and whether or not there will be a system or protocol of prioritization for faculty and staff, and if there isn't, what that may eventually look like.
So I think, was Dr. Axelrod going to help with the vaccine questions? I know right now we don't know, as Val said, how much vaccine we will be getting or when we will be getting it. So we're really still at the mercy of the county to be able to make any of those kind of decisions right now.
Yeah, what I can say about that is exactly what Colleen said, which is, I think, it would be lovely, and the goal would be to vaccinate everybody who is in the Swarthmore community, and even people within their households. That would be great. And I think that that's, my understanding is that's allowed under the rules. But if the number of vaccine doses are very limited, I think for workers who have face-to-face interactions, masked, but face-to-face interactions with students, like people in the food services, they would have the top priority. And I believe the public safety people already have been vaccinated, but people like that. And then it would sort of be up to the college administration to decide about pre-existing health conditions, age. It might make sense, for example, in the beginning to have, in addition to the face-to-face people, to prioritize people who are, say, 65 and older or 60 and older, and people who've had, significant illnesses, especially diabetes, kidney disease, and so on. So I think as the vaccines come in, we'll know more. And the more doses we have, the better we'll like it.
Thank you, Dr. Axelrod. Sort of to follow up with that, we may not actually have this answer at this point, but question with regard to the vaccination for those with whom we live in our household or other relatives. And there had been some discussion, I think, at some point about that being a possibility. And I was wondering if anybody can speak to that.
I'll take it real quickly. I just know that in terms of our comprehensive plan and designation as a closed pod, it is supposed to include all members of households. And so that's what our expectation is. As has already been said, the real question for us is we don't know when we'll be getting vaccine or how much we'll be getting at any given time. And so those are the real questions there. But according to our designation as a closed pod, it would include all students, faculty and staff families.
Sarah, I think this question is best directed toward you with regard to faculty being able to hold in-person office hours.
Sure. Similar to last semester, after we hit February 22nd, faculty are welcome to invite students to office hours. Our recommendation again was that they work with their department AAs and perhaps even the registrar's office to find out which classrooms may be big enough to make sure that there is 6 feet of distance between themselves and a student. So yes, they can have office hours. Most faculty offices are not large enough to have that 6 feet of distance. So we do suggest holding them in a larger room and remaining masked. But faculty who would like to have office hours with students are welcome to do so. We are setting up the tents again on campus. They weren't winter worthy, but after March 1st, those will go up and those will provide an alternative to inside spaces for office hours. And I expect that they'll be used more once the warmer weather comes.
Thank you, Sarah. It's somewhat related to this, and it may in fact be the same answer, but another question with regard to the people that manage lab spaces and what their requirements may be, and does that differ from the advice you just gave?
It doesn't. Again, most faculty have worked, I think, with the registrar to let folks know if they have in-person labs. We are asking for faculty to wait until February 22nd under very particular conditions and situations. We have granted a handful of exceptions for students being inside spaces. But again, if faculty need that for reasons that are really outside of anything we would usually expect, they should send a query to the COVID-19 email address, and that will be reviewed by the COVID planning group. Otherwise, faculty are welcome to hold physically distanced and masked experiences for students in their labs, just as those faculty who are interested in holding in-person experiences in classes or in studios. So that has not changed from the fall semester, and folks just need to stay aware of being masked and 6 feet apart when in labs.
Thank you, Sarah. The next question is with regard to campus visitation, and specifically visitors who may be obviously in the local community who come onto campus and enjoy our campus, and what their protocols may be, and or faculty and staff who may live close to campus and who may not necessarily be working on campus every day, but who may want to visit. And what are the protocols? What are the rules with regard to that as well?
So Vero, I'll jump in on that. So as you all know, starting in August, the campus officially closed to public visitors. We remain closed. And I know that that's a real hardship for a lot of members of the community. You know, people who are used to walking their dogs, people who really enjoy the Arboretum. But we really felt from a safety perspective, we need to continue to keep the campus closed. Public safety is taking responsibility for reminding people who don't seem to be members of the community that they shouldn't be here, but obviously they can't see everyone. So we do our best to do what we can to limit that. And the real reasons for that is that, you know, we're really trying to keep the bubble for our students so that those who are in residence here remain as safe as possible. And the converse of this is true as well. Our students are not expected to be going into the Ville. Their one cards are not activated for work with local merchants. So we're going to continue that at least for the foreseeable future. You know, if things change, obviously we will revisit that. Oh, and then another question that has come up The Friends Nursery School does have a drop-off, and they do drop off every day and pick up. Parents are supposed to stay in the car, and the staff from the nursery school, which is not affiliated with the college, will come and greet the children. So again, that's sort of a part of what's going on campus. You know, if you live on campus, and this is particularly true for faculty, you certainly are entitled to walk around with your family and your friends. We encourage you, for the sake of public safety in particular, to keep your ID handy, preferably on a lanyard, because if we see the lanyard, nobody has to ask you who you are. So we're hoping this will work to the best possible way, but I recognize it's hard for many in the community.
Thank you, Greg. Somewhat related to this, and this may be for Catherine, a question with regard to how recruitment will work in the spring. I imagine that's recruitment for new employees to the college.
Yes, thank you, Vero. Recruitment will continue. As it is, we are looking very carefully. The Position Review Committee and Greg and myself are looking carefully at which jobs we absolutely must have in order to recruit. And recruiting will be done all virtually so that we will continue to interview people via Zoom or Skype or whatever, but there will be no coming to campus. And we certainly have preferences for those who live within the local area right now, so that we're not expecting people to travel or have kind of planes, trains, and automobiles in to campus. But we will continue to work with managers on their jobs that they have posted, and so recruitment will continue. The other thing I would say also is, if people are feeling sick at all, please stay home. If there are folks that have received a negative test and then they got to campus and they felt sick, so please, if you have any of the symptoms that are on the website, try and stay home so we don't spread. Thank you.
Thank you, Catherine. And I presume it's still safe to say that in the foreseeable future, if staff are able to stay home, then they should, regardless of whether or not they feel sick or not.
Absolutely. People will be working remotely for the foreseeable future. If there is no reason to come on campus, please don't come on campus. And we would expect, like I said, that the work that we do in the spring will be remote.
Will the college be providing PPE to its employees at some point?
That's me. So PPE was provided to everyone that came back to campus last fall. And if anybody is returning to campus, you should have your PPE package. If you're needing a new cloth mask, please fill out the Google form that was sent within the Garnet Pledge that has a link for requesting that. If you're a new employee or a person that was not here in the fall and is returning and would like a PPE starter package, please use that same link to fill out your request for a PPE package to be sent to you, and I will have that sent to you. In regard to department PPE, use the same link that we were using in the fall. So if you were ordering additional items such as hand sanitizer or disposable mask or other items like that, please continue to use that. That is located on the purchase guidelines under the COVID site. So please go to that and use that link to continue to request things for your department. So at this time, you don't need to purchase items directly. You can use that site to get items for your department.
Another question that came in, will it be required to have the COVID vaccine in order to return to campus?
I can start on that, but there are others who probably can join in. The various vaccines right now are experimental use vaccine, therefore they can't be required. I believe, and we're still discussing this, and again, it's about both when the vaccine goes out of its experimental phases. We will strongly encourage and we will look for documentation, but at the present time, we're not looking to actually require the vaccine, particularly because the early onset of the vaccine is during this experimental use period when it can't be mandated anyway.
Would others like to comment additionally? No?
I think Greg's answer covered it because it's in the emergency use phase. We can't. I think we require students to have a number of vaccines, and we will certainly be looking closely at this once we're at a different phase with vaccines. So I think it's a strong possibility on the student side, but we're just not at a point where we could do that yet.
Okay. There was one question, I guess, just in need of a point of clarification from an announcement previously made by Val, whether or not there will be any change from in-person classes beginning February 22, it says here, but just to clarify exactly what we're doing on the return in the spring.
I'm actually happy to take that one. Classes begin on February 10th. They are all remote. Any class that has an in-person element will begin on February 22nd. I have heard that there's some information that went out erroneously that classes begin later in person. There are very few classes being offered in person or in true hybrid form, but we have said that anything that has any in-person element, whether it's a class meeting, whether it's a laboratory, whether it's studio work, whether it's office hours, will begin on February 22nd.
Great. Very clear. Thank you, Sarah. There's a question for Dr. Axelrod. What positive indicators might you look for in order to advise the college to be able to lift the ban on faculty, staff, and student travel domestically and internationally, at least for the summer, this coming summer or this coming fall?
I think it's going to be a combination of things that will help us decide, because there's a few things that trends that are happening at the same time. One of them is that, there was really a peak amount of COVID spread kind of around Christmas, but that's less now. It's still a lot, but it's a little bit less. So there's sort of the natural trend. Another part of it is that there are some strains that seem to be more contagious, and the more contagious they are, the more you'll see them. And we don't know yet whether those contagious strains are going to start to be a big problem that will inhibit travel or not. But the good trend is the vaccine. And I know the current federal administration is really trying to get a lot of doses and a lot of administration. And it may be that that will take over everything else. So I think when it's clear that the number of cases nationally, or at least in the area that people want to travel, are significantly lower than now, we'll clearly start thinking about it. But it's really hard to have an exact number. Like you could say, oh, well, when there's 5 cases per 100,000, that's too much. But when there's 4 cases per 100,000, that's fine. It's really hard to have an exact number, today, because it not only depends on the number, but it depends on how varied it is and how much transportation is a problem, and all those kind of things. So we'll see.
Thank you, Dr. Axelrod. And just to kind of follow up, can you speak perhaps a little to the need for us to maintain health and safety protocols even while folks are starting to become vaccinated?
Yes. So it seems pretty clear that people who are vaccinated are at much, much lower risk of getting invasive severe disease than they would have been had they not gotten the vaccine. But no vaccine is perfect. And even with a 95% protection, if there's a lot of circulating virus that people are exposed to all the time, maybe 1 out of 20 times, they still could possibly get symptomatic illness. But the trickier part is asymptomatic illness. So it's not really clear for people who've gotten the vaccine if they can pick up the virus and spread it, but feel fine, because the vaccine endpoints were really having to do with symptoms. And if you had no symptoms, you weren't tested. And so one of the worries is that if people get vaccine, they still might be able to transmit infection to others. So until there's a lot less circulating virus, and until we know more about how contagious people can be after they're vaccinated, I think the smartest thing is just to keep with the masks and the distance and the current bubble policy.
Greg, there's questions with regard to contractors being on campus and the protocols that apply to contractors. Can you speak perhaps to that?
Sure. And I hope people appreciate one group of contractors. Facilities every week has been sending out a notice about who is authorized to be on campus as a contractor. Part of that is just so you know when you see someone on campus that they're supposed to be here. And also it helps us keep tabs to make sure that they know what our protocols are relative. Their contractors are expected to follow those protocols. There are others in other academic departments who are here as contractors. The only ones who are permitted really are at the permission of the provost. So they come through Sarah's office, but the ones I'm aware of are in music, for example, but very limited because again, we're trying to limit the number of people on campus, and any such contracting needs to be pre-approved and on the pre-list, which is why, again, we thought it was helpful for facilities, given that they have most of the contractors who come on campus, to let you know who to expect and where you might find them so that you're not surprised.
Thank you, Greg. Colleen, for those who have not had the opportunity to have been tested on campus, would you mind sort of walking through the steps of exactly what that entails and what that's like so people can get a picture of how that works?
Sure. So if you have never been tested and have never registered, you will need to go to the Everlywell site to create an account on there. And they will ask you some questions, and you'll have a username and password that you create. That will be used every time that you take a test. You'll be registering a specific kit ID that comes inside the box of the test that you'll be taking. For staff that need some additional assistance, if it's been a while for testing or you are new to testing, the Schuyler room will be staffed with volunteers 8 days in February. Those dates are listed in the communication that was sent out today. And there will be people there to help you walk through the registration of a kit and the test taking if you feel that you need that assistance. There is also a video at the end of the registration process that kind of demonstrates for you how to take the test if you feel comfortable following that instruction on your own. Also, there is an email address, the CETT at swarthmore.edu email address that you can always email and let us know if you have any questions, and I can help get those answered for you.
Thank you, Colleen. I'm going to give a few seconds to see if there are any other questions. I think we've covered just about most of them.
I think there was one question regarding if you come to Campus Weekly, does that does that alone mean you have to take the test? And I would just like to clarify, it's really around if you're interacting with staff. So if you're interacting with anyone for more than 15 minutes, that's what's requiring you to take the test. If you have to come in weekly and you're not interacting with anybody, then you would not be required.
Excuse me, another question just came in. Will the testing kits at the post office be there for the whole semester?
Yeah, so staff that are not part of that their department doesn't have a specific decentralized location, those departments are facilities, public safety, dining, and athletics. You'll be able to go to the post office with your one card and retrieve a kit, and you'll also be able to drop off kits if you have taken the test elsewhere.
I saw a question come in that I think it's probably best answered by Dr. Axelrod. If you are interacting with others for fewer than 15 minutes, but several different people over the course of a day, would you suggest being tested regularly?
I actually would. You know, for any kind of infectious disease, there is a risk of contagiousness, which is almost never zero, unless you're in a spacesuit. So the rules that were kind of used were within 6 feet and for 15 minutes. And the reason for that is that most of the contagious particles that come from a person are little teeny droplets that are heavy enough so that if they're coughed or sneezed or even breathed out, that they drop down to the floor. And most of them would drop down actually within 3 feet, but 6 feet is being generous. The 15-minute idea was that probably not only do you have to breathe in, 1 or 2 infected droplets, but you probably need a minimum number of viruses to really be able to do much to get over your own immune system ability to get rid of them. So it's kind of an approximation of 6 feet, 15 minutes is not bad. But as you kind of skirt around that by being near, one person and then another person and then another person, and as that person's been maybe sitting in a chair for an hour and been breathing for an hour, and maybe the droplets spread a little further, I just think that, except for the really minimal interactions, the risk just goes up the more you do and the more people you see. And so my personal suggestion would be, yeah, I mean, if you're talking to anybody for 15 minutes, even if it's 4 people, and you're close to them, yeah, I just think that makes sense.
Thank you, Dr. Axelrod. There was a question with regard to Wear Pool and the Matchbox and accessibility for faculty and staff, and whether that will be available at some point in the spring semester or even in the summer.
I'll take that one, Vero. The athletics department has been working very hard to make the pool and the Matchbox accessible, but our first priority is to students to fulfill their graduation requirements, to stay physically fit, and to be able to practice if there are people on campus associated with particular intercollegiate teams. The athletics department, if it has extra time and space and feels confident, having put a proposal before the COVID group, may extend some of those hours. But right now, again, the focus is on our students. So information will be forthcoming to faculty and staff to the extent that they can use those facilities. We really appreciate that this is something many of us have gotten very used to. It's wonderful to be able to use these facilities, but given the seriousness of the need to stay as distant as possible from each other, we're prioritizing students. And as I said, more information will be forthcoming if we're able to open it up to faculty and staff more generally.
Thank you, Sarah. Jim, if you can revisit what you touched on earlier with regard to the student testing protocols.
Sure.
And if you have additional information, that would be great. Thank you.
Yeah, sure. So our testing approach is really identical to what we did in the fall. So as I mentioned at the outset, when students arrive on campus, they will be tested first thing before they do anything else. And they will then be tested again 7 days after arrival and 7 days after that. And then after that, we'll be moving into a regular weekly testing program for students. We're looking at maybe a slightly different approach where all students would be tested on the same day. But that's going to depend on sort of our staffing approach and the ways in which we're getting tests for students this spring. But the approach is basically the same as in the fall. We'll be testing everybody weekly. If there's some dramatic fall off later in the semester, we would consider going to, kind of a more sample testing model. But at this point, our plan is to test 100% of the students weekly.
And Jim, I like to keep going with these things. So, but there is a question with regard to plans for commencement in the spring, and perhaps if you can talk about at least what we may know about that at this point.
Sure. Folks may know we did announce a couple of weeks ago that we will not be having commencement in the traditional way that we usually do, in person in the amphitheater with all of our graduates, faculty, staff, and parents and families. Unfortunately, we just don't think it's feasible or possible to be able to do that under the current circumstances. We will be working, there's a commencement planning committee. We will be doing a remote version of commencement so that parents and families can participate that way. And we are going to be working with the senior class officers and others to see if there's a possibility to do some sort of in-person commencement experience for students in the graduating class. But exactly what that might be or what it might look like is yet to be determined. But we really do hope that we're able to do something so that students in the class can mark that occasion at least with some of their peers in an in-person way.
Thank you. Andy, a question with regard to the best source of information with regard to policy updates. And I know that Val will probably touch on this in her closing remarks, but just to put that out there again, if you would.
Sure, Vero. We've got the swarthmore.edu/COVID-19, and from there you can find all sorts of information. We're updating the site almost daily at this point as things evolve and change. And of course, if any major changes to any of the things we talked about here, we would communicate in multiple ways, including updating the website, sending out emails to folks. We know there's a lot of information going out, and sometimes it's hard to keep track of. So that's always a good source to go back to. And of course, I think Sarah maybe mentioned this earlier. If you have a question that you can't find the answer to, there's some confusion for some reason, you can shoot an email to covid19@swarthmore.edu, and we'll make sure that email gets to the right place and the right folks for discussion and get back to you.
Thank you very much.
Val, I hope I didn't just steal some of your thunder here in your closing remarks.
You did, but that's just fine, Andy. I'm sure everyone heard it and I won't need to repeat it. Thank you.
And I think at this point, I'm not seeing any additional questions, so I'll turn it back to Val. Thank you.
Thank you, Vero. And thanks so much to all of my colleagues for your participation in this session. And thanks also to our staff and faculty colleagues for your good questions and your presence here with us this afternoon. In closing, I just like to say that, we all recognize that last semester, we discovered how much we can achieve when we come together as a community. That experience makes me cautiously optimistic about what we will be able to accomplish this semester, this spring semester. So thank you all so much for being part of this journey together with all of us. Thank you so much and have a great afternoon.